No, listen, nothing comes easy. I mean, once I got out of school, I decided to go through my accreditations at the AACB and the ASDA. So I just really took love to cosmetics, and I just knew I had to get my name out there. I mean, I'm doing aesthetic dentistry now for 33 years. I was doing it when it wasn't cool. It's like years ago when I remember coming out of school, the big thing was Yellow Pages. Like every dentist was, the name of their office was AAA, Affordable Dentistry. Social media is here now. It's not going anywhere, and you just have to start. My advice is do what I do. In the beginning, it's going to be tough, but practice dentistry today the way you'll be wanting to see yourself in 20 years.
Welcome back to another episode of Dental Marketing Theory. I'm your host, Gary Bird. I'm the owner of SMC National, where we help offices just like yours level the playing field against the big guys out there so you can grow the way that you want, but you can't grow if you don't know how to clinically do the cases that you really want to do deep down inside. And today, I'm super honored to have Dr. Anthony here. He is a board-accredited cosmetic dentist at New Jersey Smile Center, and he also runs a center out on the East Coast where he's training doctors to do the kind of treatment that they want to do every single day. So he has a ton of experience. If you don't know him, you can actually go check out his social media down in the notes below. He's an absolute beast when it comes to doing smile makeovers, all-on-X, just like everything that everybody wants to do today. He's doing it at scale, and he's teaching other doctors how to do it as well. You're definitely going to want to stay tuned for this episode. All right, we are live, and I live a pretty awesome life because I get to talk to awesome people, especially in the dental industry. And today I got Dr. Anthony. And if you don't know him, you're probably not on social media. You're probably not out and about in the digital landscape because he's everywhere. And he does a ton of cool stuff. So, Dr. Anthony, I know you have your institute. I know you have a very successful practice, but I also know you didn't start that way. We talked about that before. Like, you didn't start with all these things. So where did your dental journey begin, and how did you get to where you're at today?
Sorry for interrupting the show, but I got something special for you. So we only got 27 more seats at our in-person event. We're going to be helping you grow in 2026. We're going to be putting together a growth map for you, helping you with attracting the right kind of team members, attracting the right kind of patients, and getting your systems in place for next year so you can actually grow. Now, this event is normally $499, but I have a discount code down below for $199. Make sure you sign up right away. There's only a few seats left. We look forward to seeing you soon. Now back to the show.
Well, I have very humbling upbringing. Grew up from two immigrant Italian parents, came here, and they always just instilled in me to be the best you can and to be either all in or all out. And what got me into dentistry, believe it or not, was when I was a child, I went to Catholic grammar school. I had a cavity, and back them days, years and years ago. If you actually had a cavity, the nuns wouldn't let you back into school. So my father was a military guy, and I'm 7 years old, and he's telling me, all right, you're a man. And he goes, I'll take you there, but you got to go in by yourself. So long story short, walks me into the dentist's office. I go in the back. I'm sitting there. Obviously, I'm a terrified 7-year-old. And it was around Christmas time. And I went into the room, decided I'm going to go into the bathroom and just lock myself in. But when I got into the bathroom, I decided just to take a walk, and I went out the window and left. My father wasn't very happy. So the next time he brought me to the dentist, he basically told the dentist, listen, do what you got to do, tie the kid up, just get this growing done. So they gave me nitrous, and I could still vividly remember it was a little yellow Panasonic TV that the dentist had in his operatory. And I was watching Rudolph the Red-Nosed Reindeer. So I'm basically a little stoned 7-year-old on nitrous, watching Rudolph the Red-Nosed Reindeer. I'm like, is this what it feels like to be a dentist? And that's what made me want to be a dentist. I've never wanted to be anything else.
That's awesome. And then, so I know your practice now, you're very big on social media. You have a lot of like the bigger, like smile makeover, kind of the stuff that I think like the MBA of dentistry, right? Like kind of the stuff that I feel like every dentist or a lot of dentists want to do. How did you build up to that? Because I don't think you didn't start that way, right?
No, listen, nothing comes easy. I mean, once I got out of school, I decided to go through my accreditations at the AACB and the ASDA. So I just really took this love to cosmetics, and I just knew I had to get my name out there. I mean, I'm doing aesthetic dentistry now for 33 years. I was doing it when it wasn't cool. So, and I realized that I had to get out there. And a funny story is years ago, we're talking, I don't know, 15 plus maybe 20 years ago, when Facebook came around, I actually put my business on Facebook and they took me off it because they said it wasn't meant for businesses. So I was really kind of ahead of the curve, knowing that I had to get the word out there. So like I'm out there teaching a lot of people, like, how did you do it? And I'm like, this isn't something you just build over one day. Obviously, you know that. It's just you got to keep chipping at it, chipping at it, and chipping at it, and then just create, an environment and a place for people to see you.
Yeah. And so, and then how did you get your social media to the point that it's at now? Because I think you have over 100,000 followers on Instagram. Is that kind of your marketing engine for your practice? And I want to talk about the Institute here in a minute, but how did you kind of build that out?
Well, I mean, I guess over the years, just I've followed certain people, and then I guess just what I was doing, I just kept marketing to the public and marketing my office. Like I said, that took a long, long time to build up to that. And obviously, once you get to a certain number on Instagram and these followings, once you hit 100,000, you have like bots that climb into it. So when you see these people with millions of followers, even mine at 190,000 followers, they're not all real followers, you know what I mean? But I mean, we do have a huge following. We get a ton of patients from Instagram, Facebook. I mean, a majority of our patients come from there.
And is there anything that I know what the audience is thinking right now? They're listening and they're like, okay, well, how do I start? How do I start something like that? Because most dentists don't post. They don't want to post on social media.
Oh, but you have to. It's like years ago when I remember coming out of school, the big thing was Yellow Pages. Like every dentist was, the name of their office was AAA, Affordable Dentistry,
AAA dentistry, yeah.
Exactly. So you just wanted to get up there. Listen, social media is here now. It's not going anywhere. And you just have to start. Like they obviously, because of the American Academy of Cosmetic Dentistry, I photograph everything. So you need to photograph your work, and I believe today, like websites, that's just, people just go to your website to verify you, but they find you on social media. You know what I mean? People say, well, I'm going to get a new website, but you can have the greatest website in the world. If people can't find you,
it's like a billboard in a desert, right? So it's like, what you're doing in the marketing world is called earned media. I do a lot of this too. So that's how I know about it, is like basically earned media means that you, instead of spending money, you spend your time for attention. So you've spent your time getting pictures, getting videos, filming, talking, and then you earn the following, which generates new patients.
Listen, it's all about content. I mean, everything we do is about, content, building content. Like you see a lot of dentists, and when I'm doing my courses, and sometimes I'll go to dentists and they'll be asking me about, look at my website, look at that. And it's just all stock photos. You know what I mean? You need your own thing. And even if it's only a couple cases, you don't have to start with, full mouth. Yeah. Like I remember when I first started, I was taking pictures of fillings, and then if you have technology, you need to get what's people are interested. People do surf Instagram and they look for smiles. It's keywords. It's people like you, you need to hire the right people. I don't do it myself. I mean, I know what's happening now, but that's another thing. I truly believe if you're going to hire somebody, you need to hire somebody that's not going to make your website or your social media like another dentist. You need someone that's going to set you apart.
And then how did you get into the Institute? Because I know now you have an Institute. You don't only do this yourself, but you train other doctors clinically how to do all this stuff, along with other components of the Institute. How did you get into that?
Well, I've been involved in teaching for many, many years. I went through Rosenthal's course and Dr. Nash's course, and I did some LBI and some Hornbrook, and then got involved as, a mentor with them programs where I would go. And then as of the past couple of years, I've been working with Dr. Ross Nash at the Nash Institute in Charlotte, and I've been teaching his digital program. And as this was just, evolving, I just decided to build my own for locals because I've taken all my knowledge of 30 something years. And I realized that no matter how big the case is, we could put it into a cookbook approach that if you take the right records, get what you need, get the right lab working with you, you could just give the lab this, they return this, and then it's kind of like the blue apron of dentistry. You do this first, this, and you always get a good result. I think a lot of times I'm on all these dental sites and hearing like some of these dentists, I'll show a case and say, what do you do with this? They just get overwhelmed. And I believe that dentists as a whole, a good majority of them are just stuck in a box. They only tell patients what looks broke to the patient. It doesn't necessarily have to look broke to be broke, you know? So, I mean, they're not really telling the patients on what they see. They're just looking at, all right, does that tooth have a hole in it? That tooth is missing. You got to look at the picture. You got to look at the entire picture. And I think the dentists that I've been teaching and the people that, the men and women that are dentists that not only that teach with me, but that are involved in doing the same thing I'm doing, we look at the entire picture. We don't say, all right, let's take just a frame. Here's a beautiful picture of a mountainside. We're looking at the picture. We're looking at the frame. We're looking at what wall it's going on.
Where we're going to build the house on the mountain in the future and have our grandkids running around, right? It's storytelling. And doctors are usually technicians, right? So they focus on the details. And you got to, if you're going to be a dentist, you don't want...
100%.
I feel that part of your brain hurts your storytelling bigger, like your bigger picture. Because dentists, a lot of times, they struggle with the business side of dental too, how cash flow and those kind of things. And it's like, it's not a, to me as a business person, that's not the hard part of business. The hard part's all the little technical things. And I feel like dentists sometimes, because they're technical, they get lost in the sauce with the larger themes of either explaining to the patient the future state, or even with their teams, or even the business overall. Do you feel that way as well?
Well, I'll tell you, I think one of the biggest things that I've learned throughout my years is you cannot micromanage. I mean, I have a great team here, and I pay them to do their job. Like to me, I tell them all the time, I come to work to do one thing, team. You know what I mean? You guys are running this office. Everything is open. I mean, we discuss everything. They know what the office makes. They know our overhead. They know everything. If you're going to keep that all to yourself, you're going to pigeonhole yourself into something. You're never going to grow.
And the other side of it is, if you don't share those numbers and get people on the same page with you, they can't help you where you're weak because they don't know you haven't communicated that. So people can only help you when you ask for help. I totally agree with that. Now, what would you say to the dentist who says, hey, I don't want my team knowing how much money I make because they only make this much and I make this much? What would you say?
Listen, if you're one of them people that's just worried about what your team makes, I think you have a lot of business learning to do. I mean, honestly, during COVID, my team couldn't wait to get back, even with the money they were getting from the government. They were losing money by being off, where other offices, and you see what happened in the dental world, during COVID, a lot of these places just folded down. I mean, it's your team needs to be paid and paid well. You know what I mean? They need to have bonus systems.
What's your most popular bonus system?
What is it? I mean, we just go by a production. Hygiene's got to reach certain production. Dentists have to reach a certain production. And once you reach that number, you get a bonus. And it could be as high as $1,000 a month, sometimes more. So, but you can't be worried about paying your team. Your team needs to be paid well. Put it this way, your team needs to feel that if they lose their job, or lose being a part of this team, the team that they're on, that it's actually going to affect them. Like, they have to feel this is their office.
Yeah, there has to be, not in a bad way, but a level of fear of like, man, I don't want to lose this opportunity.
It's a level of losing sense of belonging. They need to feel like they belong to part of the team. Like, you don't just pick up and leave your family. You know what I mean? Like, we are so close to the team that we have like on our phones, we have a group chat. We talk about everything, like no matter what. Like someone's having an issue, or guess what my son did today, and we chuckle about it. But we're a big family, and it's got to be that way. Like everybody's got to support each other.
So what are your thoughts on like the future of dental? So you see all these dentists that are coming in, you kind of see their mindset and their, kind of the way they think and the pitfalls and where some of their weaknesses are. You also have done well for yourself. You have a good team. You've built out an awesome office and a marketing engine for yourself. What's the future of dental? So there's like, I feel like half the dental industry is like insurance are horrible. You can't hire anybody. You can't, the DSOs are coming in, private equity, blah, 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 blah. And it's like, they're like scared. And then you got the other half of the people who are like, man, this is the greatest opportunity that we've ever lived in. And it's kind of split down the middle, maybe 60-40. Like, what is your thoughts of the future of dental?
Well, listen, I'm on the other side. I think this is a great opportunity. I do feel as a profession now, I have a son that's graduating next May from dental school. And it just seems like right now, dental schools trying to get into them, they're picking, like, put it this way, I think a lot of people in dental school should be in medical school, but they're not going there because of what happened in the insurance industry. So you have a lot of brilliant minds in dental school that have no hands. Like when I went to dental school, I wanted to be a dentist. Everybody in my class was there because they wanted to be a dentist, not because, there's no money in medicine. So I feel that's one issue. And I feel that the other hand of that is they're coming out with such debt that you're coming out of school with $500,000 in debt. And you have all these DSOs picking them up and they're making 30% of production. So they're losing the training. They're losing the technique. Like to me, I don't pay people on production. This is what you get. I want it done right. So I feel dentistry, like all these DSOs, the more that open up, the busier I get. I'm telling you, because when a patient comes to me, the patient's, Mary Smith. When Mary Smith goes to DSO, she's chart 1, 2, 3, 5. So, people want a sense of belongings. Also, insurance. I've never, from day one graduating from dental school, have joined an insurance. To me, insurance is only looking out for themselves. And I hate when dentists call it dental insurance. It's a dental allowance that's given to you from your employer through a third party. They're giving you X amount of dollars. So when someone comes to me and say, well, I want all this stuff, but you don't accept my insurance. If it's a big case and there's nothing wrong with this, you say, well, how much does your insurance give you? $1,500. All right, I'll give you a $1,500 discount. Now you have dental insurance. And it's just the way you play it with words. And listen, to me, everybody wants quality work, regardless. So another thing, doing aesthetic dentistry, people don't seem to mind to pay for it. And now you have all these other like Cherry, you have Care Credit, and all these. So you have all these companies that are willing to do it. But I think dentists, like I said, I think they're such in a hole, thinking that, all right, it's not broke. Insurance wouldn't pay for this, so the patient doesn't want it. That's not true. You can't judge a book by, a patient by when they walk in. And this can all be made affordable. Well, people pay for what they want. Put it that way. There's no question about that.
Yeah. So if a younger dentist was listening to this and saying, hey, what should I do? I'm just getting out of college. I got $500,000 in debt. What would you tell them?
My advice is do what I do. In the beginning, it's going to be tough, but practice dentistry today the way you'll be wanting to see yourself in 20 years. So 20 years from now, if you don't want to take an insurance form, don't take it today. If you want to be doing high quality dentistry 20 years from now, do it today. Just start off. It's hard to get out of bad habits. I don't know, a lot of golfers probably listening in. Once you develop a bad golf swing, it's hard to change it. But if you learn correctly at the beginning, then it's a different story. So, you're better off moving at a slower pace and developing your skills, and not worrying about extracting teeth, doing all on 4s, all on 6s, to be a quality dentist. Another thing I can tell them is don't ever think that you're above learning. I think what drives me, what drives this train is a passion for dentistry, always trying to do best I can and to be the best person I can, and realizing that I still don't know enough dentistry. You know what I mean? Once you drive that in your head and you have that passion, there's no end to what you could achieve.
Agreed. So I'm going to totally change gears on you. I just thought of this and I'm really interested on your thoughts. So the kind of dentistry that you're doing, because it's a higher ticket item, internationally, dentists have gotten better, right? So there are places in the world that people have improved their skills and are offering different services when it comes to dentistry. Now, there's still a lot of people, I've seen some bad stuff. Like even, I'm not a trained clinician. I see stuff online. I saw a guy yesterday, he went to Mexico for veneers and it just looked like there's just chiclets plugged in his face. You know what I mean? Like it was bad. So there's still some of that out there, but definitely the world's definitely getting better at dentistry. What are your thoughts on like international dentistry and kind of what's happening there?
Well, listen, there are some places that do quality work, but it's like, listen, there's an old saying, you know, good isn't cheap and cheap isn't good. So, I mean, once there's so many hands involved in it, you need technology. You know, like right now we just got modular. That helps us with occlusion. That helps us with design. That's a $40,000 piece of equipment. I mean, but listen, dentistry is getting better, but if you think you're getting a bargain, you're not. I mean, I always tell patients it's going to cost you 3 times as much. So, you know, but no, there are places. Listen, I just got back from Italy. I was there at the World Gala, and there's some brilliant dentists out there. And sometimes I'm starting to feel like they don't have the legal issues that we have. So they could do things out of the box. And I think that's why, like, honestly, patients in Europe don't go suing doctors left and right because for the stupidest thing. So like if a dentist is thinking like they could possibly save this tooth and it's not taught in the textbook, they're not afraid to do it. Like to me, I've always lived my life, not only dentistry, everything outside the box. You know, if you stay in the box, you're never going to grow. You know, the box is only so big. So, but like you said, but there are places, listen, I mean, I know Turkey's a big place now. I love them places too, just as much as I like DSOs, because I get a lot of them that offer refits.
Yeah, it is interesting though. There are some great places, and there are some definitely they're still learning. We'll just say that to be nice. Anything else that you think that we should talk about that we didn't talk about? I know you got some courses coming up. What courses could people learn from and might find value in?
Listen, we have a slew of courses. I mean, we have a direct course, which is direct restorations. We have an indirect course, which is obviously indirect crowns, this and that. Then we have our Smile Bootcamp, which I'll tell you, the people that have been taking it, I mean, we just did a course in April and May, and out of the 15 people here, I would say at least 13 of them, they've full mouth cases already. I mean, it's like I said, if you're taught correctly on how to do it, and listen, I'm not no genius or some prodigy. I mean, there's just the technique on how to do it. Like if every dentist down here listening, if you could prep one tooth, you could prep 20 teeth. It's just you need the right sequence on how to do it. Once you do that, once someone does a case like this, they'll all end up saying, why wasn't I doing this for years? Because it's not as complicated once you know what you're doing and what you're looking for and what your lab should be giving you. It's not as complicated as you think it is.
What's the right kind of dentist that would come to that Smile Bootcamp you just described?
Listen, I have dentists that are out of school a couple years that are like, listen, I just don't want to be in this DSO world. And my last class, out of the 15 people here, 6 of them were people that I graduated from my class. So they're out 33 years. It's for anybody that just wants just to take, it's not even taking your dentistry to the next level because you're already doing this dentistry that people just aren't putting it together and they're afraid to treatment plan it or they don't know how to treatment plan. So this isn't everybody's charts. Like you could easily, I could go in somebody's office being a new dentist there, and I promise you, I could definitely increase their gross $500,000 just by going through their charts and talking to their patients.
That's awesome. How can people find those courses and connect with you?
Well, it's on the IADE Center website or Smile Design Bootcamp.
Okay, that's IADE.
Yeah, the letters behind me right there. IADE Center. IADE.
If you're watching online, then you can see it right behind him. But if you're listening, it's IADEcenter.com. Go check him out. Dr. Anthony's awesome. He's a very, very gracious man, and he's done amazing things, and he's giving all this information back. And every interaction I've had with him, he's always trying to give me something. He's always like, Gary, let me help you this way. Let me help you that way. And I really value that in people. So if you are thinking about growing, or you thinking about learning things, different skill sets clinically, please connect with him. He's the right guy to know, and he's going to give it to you straight. He's from Jersey. So there's no sugarcoating.
Also, like you were saying to me, it's like why, what makes me the passion. There's a passion also. Being a good person means giving. Like a lot of people that take my course in Jersey are like, why do you want to teach other dentists how to do this? So I'm like, because there's plenty of teeth to go around. You know what I mean? To me, and there's something in it for me. When I'm teaching something, I'm always learning something too. So I kind of like the camaraderie. And I love seeing a person call me up and say, listen, I've never done a case like this. And I did 3 in the past 2 months. It's a good feeling. I mean, believe me, I can't do it all, even if everybody sends it to me. It's impossible. So may as well teach other people how to do this.
There's so much opportunity out there. It's almost endless, and we just have to learn how to tap into it and see it. So thank you so much for coming on. You did a great job. Love learning from you, and I'm excited for the audience to connect with you.
Like I told you, I need to get you in this school. You're a little genius in your own mind. In your own right.
You got it right the first time. A genius in my own mind. That is correct.
A genius in your own right also. Let me tell you, you know a lot of stuff.
Thank you, my friend. I appreciate it. And it was great having you on.
All right. Thanks. Bye-bye.